there. I'd like to introduce you to my friend and colleague, Diane. She is a very skilled pediatric physiotherapist who has volunteered in various countries around the world, including a small project in northwestern India that I have been project managing for over 10 years.
And I'd like to introduce you to my friend and colleague, Alexis. She's a pediatric occupational therapist who helped to start a small global health project in Ladakh, India many years ago. We are going to tell you a little bit about this adventure we've been working on. The Ladakh Disability and Rehabilitation Teams, also known as LDRT, are a small group of allied health professionals, mainly from Sunny Hill Health Center, who have been partnering with local healthcare professionals at the Sonam-Norboo Memorial Hospital in Ladakh to build capacity of assessment and treatment skills and to raise awareness of disability. Since 2007, these teams have included professionals of occupational therapy, physiotherapy, speech-language pathology, special education, and developmental pediatrics.
Ladakh is situated in the Himalayan region of northern India. Impassable by road for most of the year due to harsh winter conditions, it has become a popular tourist destination in the summer, where sightseers, mountaineers, anthropologists, and even Indian tourists who seek respite from the heat. However, until 1974, the region was closed to outsiders, and since then, with the influx of tourism money and exposure to modern habits, behaviors, and technology, the region has developed at an extraordinary rate. The LDRT project was established after a Ladakhi NGO requested tours and education sessions at Sunny Hill Health Center in 2005 and 2006. Over the years of the partnership, the project has always been led by rehabilitation therapists, which has helped maintain an equal footing with the rehabilitation team in Ladakh. In 2010, with the assistance of the Canadian team, the Pediatric Unit for Children with Disabilities was established at the local government hospital in Leh, Ladakh.
The goals of the LDRT project are to support the local therapists in developing competencies on disability assessment and treatment. This is carried out by the Canadian team providing education sessions and with the Canadian and Ladakhi therapists participating in joint assessment and treatment sessions with children and families. The global disability estimate is 15% of the world's population. This is reported to be true for Ladakh, with even higher incidences of disability in some of the more remote villages. The population of Ladakh is approximately 300,000, but there's also a high transient population during summer months. Although the numbers are relatively low, the remoteness of the region increases the severity of the need for services. Ladakh is often referred to as one of the highest habited places in the world.
Major milestones of the LDRT project include village disability assessments and camps, opening the pediatric unit, ongoing support of the professional development of the Ladakhi staff, hiring of new rehabilitation staff for the unit, and publications in a peer-reviewed journal and a textbook, and the focus of a capstone research project. And in addition, we have established a registered Canadian charity to help fund the work, which is called CHI, or the Canadian Himalayan Association for Innovation.
This project helps families and children with disabilities by working to improve services in a culture that has a history of significant shame and stigma about disability. We are working to decrease the stigma of persons with disabilities and raise community awareness by providing mentorship and collaboration. With a focus on empowering female healthcare workers and mothers of children with disabilities, the aim is to promote human dignity by improving access to quality healthcare services.
The remoteness of Ladakh adds to the complexity of gender and disability challenges. So by using education-based projects, we will gradually help to break down the social stigma. The capacity-building nature of this project has been a main success in that we have strived to minimize hierarchy between the Ladakhi and Canadian teams. We are doing this work because it is a step forward in the long road of establishing and improving disability resources in low and middle income regions. For more information, visit these sites or contact Diane or myself by email.